A patient kissed me last week, and it made me reflect on how we as doctors use touch in medicine. When I was in residency, I remember being taken aback when one of my attendings refused a handshake from a patient, and she said, "I don't shake hands with patients." And during the pandemic, this hands-off approach was quite common for obvious reasons to mitigate the spread of COVID-19. But now that we're through that, I want to share my reflections. So to me, handshakes are a gesture of trust, and I'm always very open to shaking a patient's hand when I meet them and when I send them home. A comforting touch like a hand on the shoulder, when it's done appropriately, would probably mean a lot to a patient if you've just broken bad news like a miscarriage or a bad diagnosis like cancer, or if they're just emotionally struggling for whatever reason. And I think some patients just want to express their gratitude in their own way, like through a hug. But just last week, I was shaking the hand of an elderly European man as I was sending him home, and he embraced my hand and kissed it like this. And it was the first time that a patient had ever kissed me. And honestly, it was kind of like a sweet human moment. Of course, boundaries are important. Like some specialties like psychiatry avoid touch altogether to maintain clear lines. But in the ER, the boundaries feel a little bit different. But what do you think? Should doctors shake hands, hug, or even accept gestures like this from patients? And where do you draw the line between professionalism and human connection? Let me know your thoughts down in the comments.